Universal health coverage remains the government's main policy thrust, with the Ministry of Health reviewing and expanding public healthcare services to improve access and reduce the financial burden on patients. Chief Medical Officer Sharon Belmar George says the ministry has been reviewing clinical protocols, standard operating procedures, and staffing needs, while also responding to patient concerns and the demands at various health facilities.
Universal health coverage is the government's main policy thrust for implementation. This means access to quality clinical care to the population and a reduction in out-of-pocket payments, that is, without putting them through financial hardships.
The ministry says staffing has also been increased, particularly among district medical officers, while additional clinics have been introduced to help reduce waiting times as more people access care through the public system.
So to ensure we could reduce the waiting times, and we also increase the number of clinics that we were providing to the public. So we also increased the numbers. We've also looked at the medication that we use. We are working with the pharmacy services. We know we have some shortages there, but we have been working closely with the chief pharmacist to see how we improve on the allocation of pharmacists within the primary care services.
Efforts are also on the way to strengthen urgent and emergency care, pre-hospital services, and port health, while work continues on the National Blood Bank and the commissioning of additional services at the new St. Jude Hospital. The ministry is also advancing plans to expand the Grosley Polyclinic and transition it to 24-hour operations. The chief medical officer says reviews of health facilities will continue, with senior clinical officers regularly assessing services and the quality of care being provided.
Given the assessments that we've carried out on the public sector services over the past 6 months, we will be continuing those health facilities reviews with the senior clinical officers within the Ministry of Health. So there will be more officers, both myself, the medical officer of health, and the senior medical officers visiting our clinical services on a continuous basis to ensure that the quality of care is what it should be to the public.
The ministry says the reviews and facility visits will continue as it works to improve the quality and accessibility of public healthcare services across St. Lucia. Shane Stephen, NBC Prime.